On-the-scene video coverage of ESC 2012 is supported by Pradaxa.
Welcome back. We're here at the European Society of Cardiology meeting in Munich, and one of the interesting trials, Chris, that was presented dealt with the mitral clip.
Yes, this was another one of the registries that presented at the so-called late-breaking clinical trial session, but a large one of 560 patients with severe mitral regurgitation. 85% of them had class 3 or 4 heart failure, and use of the mitral clip got 3/4 of them down to class 1 or 2 heart failure. Similar reductions in the mitral valve score, etc. So the clip seemed to really do its job. Of course, this isn't available in the United States, but is around the world, and so a nice sort of real-world experience with this mitral clip.
Yeah, it was certainly very encouraging that this very large experience was positive with the mitral clip and does confirm the results in the United States. Again, there's an emerging trend of devices undergoing very careful randomized clinical trials in the United States with a prolonged period prior to approval, whereas they're available in Europe and they gather enormous amounts of data, such as the mitral clip. So no control group, no comparison, but some pretty impressive results in terms of exertional capacity, left ventricular function, reduction of mitral regurg. It can't all be placebo.
That's right. Well, another registry, actually 4 registries put together, the FAST MI program looked at every 5-year looks at management of ST elevation MI, and showing very favorable trends, I think, on number one, mortality come crashing down over this 15-year period starting in 1995. What had been your sense of this overview?
Yeah, well, there's no question that the mortality rate from STEMI in France came way down, but disturbingly, only about 3/4 of that mortality benefit was due to reperfusion, PCI. About 25% of it was due to to so-called patient characteristics, but not necessarily favorable in that the patients tended to be younger and healthier, so they survive better. But it's a little bit disturbing that younger patients were having acute MIs, mostly females, and a lot related to smoking.
Yeah. You know, of the trends, they looked at the relative use of primary PCI versus thrombolysis. There it was 62% or so, I think, primary PCI down to 14% thrombolysis in Europe. So that trend is really very strongly favoring the interventions. Nicely, the percentage of people who got reperfusion went up, and so it was only about half the patients back in 95 who got reperfusion, and that's down to just 30% getting unreperfused, 25 to 30%. And so I think a very important metric of getting reperfusion to patients and that driving benefit overall.
Absolutely, and the patients got it sooner, so their door-to-balloon times went down. They talked about cultural changes, the fact that people now are becoming more attuned to acting rapidly upon symptoms and to calling the emergency vehicles rather than getting themselves to the hospital. So the last study in the late-breaking session was the so-called GRACE study that was actually a sub-study of the ORIGIN study that looked at the role of long-acting insulin, glargine insulin, and at omega-3 fatty acids in preventing atherosclerosis, atherosclerotic events in diabetics and patients with high risk. And the ORIGIN study, of course, was negative, and this was a sub-study looking at carotid intimomedial thickening. And even though the insulin arm showed a trend toward a benefit, wasn't statistically significant, the omega-3s were totally neutral.
You know, it's nice to have imaging as a sub-study within a large clinical trial to try and understand it. It's then hard if both of the components are negative clinically and similarly not showing much on atherosclerosis. I guess some concordance in theory of those two. I have to say the omega-3 fatty acid being totally negative in a 6-year study is of interest because there were 2 other prior ones, Jealous and Gissi Prevenzione, showing benefit in prevention. This was isolated to diabetics who have a lot of other drivers of their atherosclerosis. But a bit of a dampening on the omega-3 fatty acid story. Fortunately, there is another trial ongoing in a broader population, so we'll see more on that.
Yeah, the literature really has been conflicted on the omega-3 fatty acids. I'm going to continue to take them myself, even though I don't like the fishy aftertaste, and hopefully I'm doing some good. So very interesting trials here in Munich. Thanks for being with us.